Mr. and Mrs. Lloyd, how are you? Here you go. Here's Sophie. She had a great complication-free surgery. She's eaten, and she's also been toileted this afternoon. As you can see, she does have a nice light bandage on her belly from the surgery, which you can check later this evening and then just completely remove the bandage in tomorrow. She also has a nice little pink pressure bandage on her leg just from where the catheter was, which you can remove tonight. Now, what we've done, here's your discharge pack. In the pack, you'll see that we've given you 2 tins of AD, which you can give her for dinner tonight. Probably just one, as she may not be up to eating that much. Smaller the better at this point. So if you just give her a little bit at a time, that would be amazing. It's just to increase the calories after the general anesthetic with the calories that she lost. You've also got here some anti-inflammatory tablets, which we've already chopped up for you. There's 4 days worth starting tomorrow morning. You will need to give it to her orally, once in the morning with her breakfast and once in the evening with her dinner, just making sure that she's got some food in her stomach just to line it so that there is no any pain from the anti-inflammatory. It just coats the stomach. It is a non-steroidal, which is just for the pain relief and the inflammation of the surgical site. So what you will need to do is just open her mouth and pop it at the back of her throat, and just make sure, holding her head up slightly, massage her throat to make sure that she does swallow it. There can be a few side effects with it, which would be vomiting, diarrhea, and a decrease in her appetite. If this is the case, please give us a call, and we will ask you to bring her back in just to make sure that she is okay. Now, for the next couple of days, you will need to keep Sophie quite quiet. Just give her some extra bedding at night or to sleep in during the day, just for the comfort where she has had her surgery, because she will be quite sore. But in a couple of days, she will be starting to feel getting back to her normal self. She should return back to her normal self within the week. We will have her come in 3 days just to make sure that the surgical site is nice and clean and dry. If you do wish to clean it, there may be a little bit of blood just from after the surgery with the bandage. Just take a nice warm, soft cloth with some warm water and just gently rub the blood off. But if you can please check on a regular basis just to make sure that there is no discharge from the wound. If there is, please give us a call and we will ask you to bring her in just to make sure that there is no infection occurring. With toileting for the next 3 days, if you can keep her as quiet as you can on her lead, not for very long, just to make sure she does go to the toilet. Once she's had that recheck, we'll reassess how her healing is going. She will still need to be toileted on her lead until her stitches have been removed, to ensure that there is no ripping, just a usual precaution that we have. Do you have any questions? Okay, that's great. If you can think of anything, if there's anything that's troubling you or you're concerned about or you just want to ask about, if it's normal, please don't hesitate to give us a call and we will answer any questions that you've got. Great. We'll see you in 3 days. Bye.